Hello, welcome to a fresh edition on the program Health 247. I am your host Irene Okechukwu. On this program Health 247, it's everything relating to your health, always making health your priority. So today we are going to be talking on cervical cancer. Cervical cancer is the most common cancer in women and the second most frequent cancer worldwide, which can happen to young girls at their reproductive age and also women. Cervical cancer refers to the cancer of the uterine cervix, that is, the lower part of the uterus, which extends slightly to the top of the vagina, where baby grow during pregnancy. Some women go through a lot of abnormalities without knowing the causes, such as pelvic pains, mistaking it for menstrual pain, pain during sexual intercourse, abnormal heavy bleeding during menstrual flow, abnormal vaginal discharge which comes with foul smell. All this could be the signs of cervical cancer. But the good news is that cervical cancer is treatable if early detected through pap tests or HPV vaccines. So today, as usual, I won't be alone because I will have a gynecologist who will be taking us all through the topic cervical cancer. He will tell us what cervical cancer is all about, tell us the symptoms, and tell us the preventive measures on how to go about it. But before then, I would love you all to go on our social media handles, do as well by dropping a comment, and as well for us on all our social media handles on Rapid TV channel 176 on Star Times. So see you as I introduce our guest to you. Alright viewers, welcome back. As I said that this topic I will not be treating it all by myself because I will be introducing a gynecologist who will be taking us all through the topic cervical cancer. And today we have a gynecologist. He is none other person than Dr. Mike Enokela. Dr. Mike Enokela, it's a pleasure to have you on the program.
Yeah, thank you very much, viewers. It's also my pleasure to be here with you.
All right, I have a lot of questions to ask on the topic cervical cancer because it has been one of the most trending topic on health because so many, the most prevalent cancer in women is cervical cancer, and that is why I want you to explain further on what cervical cancer is. Can you tell us what cervical cancer is?
Nice having me with you today, viewers, and it's my sincere pleasure to be here with you. Thank you very much. Cervical cancer, it's a very big problem, especially in the sub-Saharan Africa. It's a disease of the cervix. The cervix is essentially the neck or the opening part of the womb. The womb has its body and it has the neck. So at that entrance into the womb, that's the part that we call the cervix. And that cervix, once it's cancerous or is diseased and becomes a cancer, it spreads to the entire womb and to the remaining part of the cervix. So the cancer of the cervix just means a disease of the cervix that is termed or is called a cancer, or is a malignancy in the medical terminology. But essentially, it has to do with not the entire body of the womb, but the opening of the womb. And it's interesting to know that cervical cancer is about the third commonest cancer of women generally in the world. And then in most of the African countries, about the second commonest in women. You know, after you mention breast cancer, you're talking about cervical cancer among women, especially in this part of the world. So it's a very big problem that require a lot of attention by both individuals and corporate organizations. So in a nutshell, it's a cancer of the mouth of the womb. That's what we mean by cervical cancer.
All right, people have been wondering and I've been thinking, what could lead to this cervical cancer? Is it just a malignant tumor that just grow at the cervix? How does it come about?
Thank you very much for your question. Um, in gynecology world space now, we have termed cervical cancer as one of the cancer that is sexually related. What that means is that the main cause of cervical cancer is by a virus called human papilloma virus. And this human papilloma virus is sexually transmitted from the male to the female folk. In more than 90% of cancer of the cervix is caused by this virus called human papilloma virus. And there are different strains of this HPV, but the commonest of them that is prevalent in this part of the world is human papilloma virus, the strain 16 and 18. And then by extension you have 6 and 11 as well. But this 16 and 18 HPV have been implicated in a whole lot of cancer of the cervix. If you want to say causes, yes, being the major organism responsible for cancer of the cervix, it means that there are risk factors associated with the incidence of cancer of the cervix. Answering your question as by what would have caused it. There are certain category of people that are higher risk of developing cancer of the cervix.
Okay.
Yeah. I'll just say that it's sexually transmissible viral infection that can increase the chances and grows into causing cancer of the cervix. It means that women that have multiple sexual partners are at a very high risk of having cancer of the cervix. And when we talk about multiple sexual partners, it's not just like the prostitute, so to say. It could be a particular woman that has a male partner, and the male partner has many other partners. So by extrapolation, that woman is having multiple partners by extension. Other risk factors could be with a young lady that has early coitus. Coitus means it has the first sexual exposure or sexual intercourse at a very young age. Because at that young age, if the virus is transmitted to her, the virus have ample time to develop and to grow and to multiply and to cause changes in the cervix to become a cancer.
Wow.
So early sexual initiation is a risk factor as well. Other risk factors for women that could come down with cervical cancer are women that have a lot of children, plenty children. Women that we call them multiparous women. They are at a risk of coming down with cancer of the cervix. Then you also talked about women that use tobacco, that smokes. Smoking is a risk factor for cancer of the cervix because smoking has what we call carcinogenic property that can cause a change, a transformation in the cervix, especially when the woman is exposed to this virus. So smoking is also a risk factor for cancer of the cervix.
Just to cut you short, you just said something that the disease could be transferred from having multiple social partners and is carried from the male. That's when you spoke about HPV, right?
Yes.
I want to understand something. Do men know that they are carriers of HPV?
Men know the carriers of HPV. The unfortunate thing is that in man, it is largely asymptomatic. A man may not cause any symptom. A man may carry HPV for years and he may not come down with anything because he has not got the cervix. where this changes takes place, it doesn't have the cervix, so it may not come down with that kind of symptoms until it gets into the woman, and then it multiplies and starts causing the changes in the cervix. So maybe when we talked about prevention, that's why we have the campaign is on now that both the female and the male boys and girls should be vaccinated for this HPV, because in the man it's likely asymptomatic, so they may not even know for all their life.
All right. So, what are the symptoms of cervical cancer?
Yes, thank you. Cervical cancer would produce symptoms, as the name goes, cancer, when it becomes cancerous. I say that because it's one of the cancers that have what we call pre-cancerous stage. That means there's a stage before it becomes a full-blown cancer. And at that pre-cancerous stage, it may not present with any obvious symptom or sign to the doctor. But when it has become a cancer and the patient is manifesting the frank symptom, one of the commonest complaints that such patient will have is that she could have what we call contact bleeding. And contact bleeding means that anytime anything touches her cervix, it comes with bleeding.
Wow.
Yes. Even if she tries to wash herself and she puts her hand into her vagina and the hand touches the cervix, it will be met with bleeding. If she meets with her husband or her partner after the intercourse, there's what we call postcoital bleeding. There will also be bleeding.
Wow.
Apart from contact bleeding, she could have intra and intermenstrual bleeding. That is in between her period. She will complain that she just finished her menses, and after that there's still some bleeding. She bleeds normal period, and subsequently there is still intermittently there's still blood stain, blood spotting here and there. So intermenstrual bleeding is also another complaint. And aside that, the patient could also complain of abnormal vaginal discharge.
Okay.
Abnormal vaginal discharge, meaning that the discharge from the vagina could be foul smelling, odorous, not a pleasant one at all. And it comes spontaneously and intermittently. And this is not a kind of discharge that she will go take a drug or thinking is a pelvic inflammatory disease, what they commonly call PID, and she takes it and get better. No. It's a discharge that even if the more drug you're taking, the more she keep having the discharge.
Wow. But
then, yes, it could also, at that point, the woman may have become cachectic, have lost a lot of weight. Yes, she could have pain in the pelvis. She could have, when it's pressed the bladder, she could have painful urination, frequent urination, constipation. All of that could happen depending on the stage of the disease.
All right, viewers, you have been listening, and before then, we are going to go for a short break, and we will come back. Who's going to tell us ways on how to prevent cervical cancer. All right, viewers, welcome back. So, Dr. Inakala, can you please tell us what are the prevention on cervical cancer?
Yes, and this actually is very important. For me, it's the main aspect of the discussion is prevention of cancer of the cervix.
All right.
It's because it can be prevented. In fact, it's one of the cancers, or is about the cancer that can largely be prevented, because the cervix is outside the abdomen. So we have different levels of prevention. We have the primary level of prevention, maybe we call it secondary, and largely primary and secondary. Let me stop at that point. the primary level of prevention, I remember saying that one of the risk factors of cancer of the cervix is multiple sexual partner. So if the lady stays off from multiple sexual partner, she's helping herself to preventing herself from having cancer of the cervix. If the two, the man and the woman, keeps regularly to themselves, not going out, it's a preventive measure for cancer of the cervix. If a young lady do not get sexual initiation very early, these days we have like 10, 11, 12, 13 getting sexual initiation. If that is not the case, it's a primary level of prevention. If she also abstains from taking things like tobacco, like smoking, let me use the word, it's a level of prevention. If she must engage in sexual intercourse and she uses condom, yes, condom has some level of protection for the woman, and by extension preventing her from coming down with cancer of the cervix. Also, she could have this vaccination, and we're seriously campaigning that young girls between the ages of 9 to 14 years, both girls and boys, should be vaccinated, because this is also a primary level of prevention of cancer of the cervix. So if all of these are put in place at that level, it will help preventing the cancer of the cervix. Then if you jump from primary level of prevention to secondary level of prevention, it means that this individual or the young lady, once every 3 years, if she's of a reproductive age group from 18 years and above, she can present herself for what? For pap smear. Pap smear. I mean, that especially if she's sexually exposed to, she can present herself once in 3 years for pap smear, because the pap smear will be able to tell us if there is any abnormal changes in the cervix that could lead to cancer of the cervix.
Yes.
And at that point, once it's picked, we'll be able to know what to do so that she doesn't come down with a frank cancer of the cervix. The same thing goes with other modalities of checking the cervix that we do, all to preventing the female folk from coming down with cancer of the cervix.
But I was beginning to think that at this stage, like going through the symptoms you just listed right now, at this stage, do you think that it could be treated? Like, could solutions be preferred at this particular stage?
Yeah, talking about treatment for cancer of the cervix, it's like any other cancer. When it's in advanced stage, it becomes largely palliative. You know, becomes a palliative care. You won't be able to treat it per se. You know, but before it gets to even become a frank cancer, that's why I say there is a precancerous stage. And that's why we have this common saying that women should go for a check of their cervix. Because if it's at the precancerous stage where there are changes in the cervix, that we know that those changes can lead to cancer of the cervix fully, there is treatment for that at that stage. When we do what we call pap smear, for example, I had a patient today that came with an abnormal pap smear. So when we have an abnormal pap smear, there are treatment modalities for that.
Okay.
Because at that point, it has not become a frank cancer of the cervix yet.
Wow.
It's still in the precancerous stage.
Okay.
So we can do a lot of treatment modalities. When it's in the precancerous stage, meaning that there are some changes occurring in the cervix.
Okay.
At that point, we can either decide to burn it off. We can burn it off from the cervix, or there's a way we can take a biopsy. We cut that place off from the cervix and take it to the lab. Or there is what we call electrocautery. That's kind of use an instrument that you cauterize it. That's also like burning it off the cervix. Then, if it has moved from that precancerous stage and that become a real cancer, cancer of the cervix, if it's in stage one oftentimes we can still treat.
Okay.
Can treat at that point. So oftentimes we may want to do a surgery. Surgery means you may want to remove the cervix and remove also the womb.
Wow.
What we call total abdominal hysterectomy, meaning you remove the womb or remove the cervix. And if it's gone beyond that, you may want to still remove all of this, but you will need to give chemotherapy.
Okay.
You need to give radiotherapy to the patient. That's using radiation to also burn some of the cancerous cells wherever they may be hiding. Because even when you have done surgery and removed the cervix and the womb, some of the cancerous cells are still there in the body of that woman. So you need to use radiotherapy to kill them off or burn them off, as it may be. And then you may need to use chemotherapy, that's drugs, very serious drugs, so to say, to be able to go through the system and then fight all the cancerous cells as much as you can.
You have been watching Health 247 on the topic cervical cancer. Right now we are going to know the recommendation on how to avoid cervical cancer. Please, can you take us through on how we could, the recommendable ways on how to avoid cervical cancer?
Yes, thank you very much. My recommendations are simple. Cervical cancer is a preventable disease, and that all women should be fully enlightened, should be informed about cervical cancer. I tell a lot of my clients when they come to see me at the clinic, you have access to the internet, so don't be ignorant in this age and time. That's number one. Then number two, for you to prevent yourself from having to come down with cancer of the cervix, you need to regularly come for a check of your cervix. Not only when you have a concern, not only when you're pregnant, you deliver, no. Every woman of reproductive age with sexual exposure, once every 3 years, can present herself for a pap smear. It's a simple test that we do on the cervix to see if there is any change that can lead to cancer of the cervix. And thirdly, of course, going back to primary prevention, she owes herself the responsibility of keeping to a partner, because the virus that causes cancer of the cervix predominantly is transmissible from the man to the woman. And so if you keep to a stable partner, the chances of cancer of the cervix is markedly reduced. And then lastly, if she has any concern, if at the end of being evaluated by her doctor and they discover there is any abnormal changes in the cervix, she should follow through. There are steps we take to making sure we get to the root of the matter. And if it happened to require a surgery, she should present herself for the right treatment to be given to her. Thank you very much, viewers, for having me. I'm sure you've learned a lot from this discussion. I hope to be with you sometime again.
Thank you very much, sir. All right, viewers, that is the much we can take on the topic cervical cancer. And as he earlier said, if you are a lady, a young girl, don't forget, this cancer is treatable, especially when it is detected at an early stage. So feel free, visit a primary health care and get yourself vaccinated. Feel free as well to come to the hospital for checkup, because cancer is not what we should joke with. Remember, Health 247 is making health your priority. So see you some other time on our next topic. Bye.